Now, it's increasingly clear that COVID is a seasonal disease like other coronaviruses, and winter pressures have plagued the NHS for pretty much every year I've worked as a doctor. But this autumn and winter coming will be different. The NHS has reduced hospital capacity as a consequence of social distancing in hospitals, the increased need for infection control measures such as testing, and the burden of cleaning and PPE on throughput. So even if the numbers of patients needed to be hospitalised with COVID this winter is radically reduced, and we all hope it will be, the NHS will still face pressures as a result of normal winter pressures from diseases like flu and pneumonia, but with reduced capacity as a result from its COVID infection control measures. And so when I asked my local hospital, St Peter's, what they need further to increase NHS surge capacity, is it more money, real estate, oxygen? They say the limiting factor is more trained staff, and I'm sure that's the case in many of our hospitals. Now, of course, the NHS and our staffing plans weren't designed for surge capacity in a pandemic or recovering from one. Why would they be? And while the roadmap today has focused on what we need to do to reduce numbers of patients who need to be hospitalised, we also need to think of the other side of the equation, how to increase overall NHS hospital capacity, not just surge capacity for COVID, but for all care in a post-COVID world. And while I welcome the announcement of increased nursing applications over the weekend, we need these nurses now. We know winter pressures will be coming later this year. What do we need to do now to prepare us so that we can live with this virus, as this roadmap today charts, for the long term, and to cover and prevent any prospect of future restrictions?
Well done.